Hi, and welcome to the Organism Series. Today we're going to talk about Bartonella henselae. Bartonella can present in three classical presentations. The first presentation is usually called cat scratch disease and presents with localized lymphadenopathy. This is the most common presentation of Bartonella henselae. It usually starts with a papule or a pustule at the site where you get scratched. Then you see lymphadenopathy wherever that site drains via the lymph system. Commonly, we see it in the axilla, as patients often are scratched on the hand, and it's uncommon to see systemic symptoms. Usually, it resolves spontaneously within a couple of months. The second form is ocular. It's associated with the syndrome Perino-oculoglandular syndrome, where you see conjunctivitis along with preauricular lymphadenopathy. In rare situations, it can also be associated with neuroretinitis. And the last form is seen almost exclusively in patients with HIV, and this is when Bartonella causes bacillary angiomatosis and pileosis. From a micro perspective, Bartonella is a slow-growing gram-negative rod, can be difficult to isolate and grow, and it's transmitted to humans by either cats or fleas on cats. Kittens are higher risk for transmission to humans due to higher bacteremia rates. As mentioned before, once scratched, it usually takes 1 or 2 weeks to see symptoms. Diagnosis is usually performed using serologies, however, it's important to note that these are not ideal tests and have a high rate of cross-reaction. However, other tests have their own limitations. If tissue can be obtained, PCR can identify the organism, but culture of it is difficult. On rare occasions, it can be identified on staining from a biopsy. The decision to treat is often dictated by the severity of symptoms and the underlying immune status of the patient. Even in patients who have systemic disease, if they are minimally symptomatic, it's not clear whether treatment is indicated as long as they are immune competent. If a patient is immune compromised or has severe disease, then treatment is recommended. For retinitis, you want an agent that has good efficacy in the eye, so doxycycline or rifampin are often chosen. For patients with bacillary angiomatosis, we often use macrolides or doxycycline. Hoping haven't convinced anyone to avoid cats, as I'm definitely pro cat, but that does it for Bartonella henselae. Check out the rest of the Organism series on the Simon Says ID channel.